Chapter 6, Biological Development in Adolescence. Here are the learning objectives. Adolescence. So there is no actual time frame. So the definitions will vary, but adolescence is the space between where a child grows into an adult. And during this phase, they go through puberty. Some people say that it begins around 11 or 12 and ends in the late teens, but some say it more so has to do with puberty. And we know that some kids at the age of 6 or 8 start puberty. So it just depends. There are many major changes during adolescence. Puberty is where there's an enlargement in the reproductive organs and sexual genitalia. And there's also secondary characteristics, and that would be things such as hair, the deepening of the voice. So as far as growth spurts go, it shows that girls grow around their full height around 16, and boys um, will grow until they're about 18 or 20. It just depends on the individual child. There is an increase in hormones secreted by the endocrine glands, and that's what helps people during this age, children, adolescents, to grow. There is hair, areas in the brain that are growing. Shoulder joints are getting stronger, and the female body is also responding to estrogen and progesterone. There could be a significant increase in growth, so it can be about 2 to 5 inches. And usually girls are shorter than boys during that time period, but before that, we know that girls are taller than boys. So the muscular structure changes, the hands, the head, and the feet grow big. So that is usually when children or adolescents experience that awkward phase, because all of their body literally doesn't fit because their body is still developing. So their legs and their arms will grow, and then after that, it'll be pelvic, hips. The last thing to grow is the trunk or their torso. Psychological reactions to physical changes. People going through puberty and adolescence, they are critical of themselves. Research shows that girls are more critical of themselves than boys are. Um, Girls tend to dwell more on their physical imperfections, but all teens go through well, even preteens, they go through the period of self-criticism and being awkward and just trying to figure out how they look, what their new body looks like, and how it continuously changes. Um, so people who consider themselves to be attractive as compared to their other peers or friends, they are more outgoing, more outspoken. Those that still feel negative and insecure are more likely to be closed off or shy. Of course, that's not always the case, but as far as research goes, it shows the majority. It also demonstrates that girls tend to blame themselves with things that go on with them, and boys tend to blame everyone else except themselves. So, and also there's a difference when an adolescent matures early or if they mature late. So those who mature early for boys, they play sports, they become dominant, people look up to them and listen to them. It could get them into some situations where they're around people who are older or they're perceived as older because they've had their growth spurt, hair starts growing on their face. They're, they might have bodily hair, but for the most part, it's more of a positive thing. As far as girls go, it's more negative. If they were to mature early, um, those that mature early feel insecure about their bodies, especially if they develop breasts, before other girls or having to go through their periods while in school. So they might start wearing the sweaters that we see nowadays, covering their heads, wearing baggy clothes because of insecurities. because there'll be more pronounced or pointed out since since everyone in their peer group doesn't have those physical changes yet. Um, and then girls that mature late might have some anxiety while they're waiting to mature because they feel like they don't have the body that now the majority of their peers or friends have. So it might make them feel anxious and shy and less attractive. During adolescence, boys experience greater changes in their brains than girls do. And some researchers attribute their increased aggression and irritability to those changes that they go through. The book mentions the idea of mind altering substances and adolescents who are at risk for that. So it could be environmental factors, peer influences, family influences, and maybe their personality. So environmental factors that might contribute to the use of experimentation when it comes to alcohol or other substances could be being poor, inadequate education, unemployment in the area or city that they live in, lack of positive role models, and absence of opportunities to do other things. So maybe they don't have parks or they don't have a playground or a basketball court. Maybe they don't have access to sports teams because their parents can't afford it. Maybe they don't have access to working a teen job. There is also peer pressure, parental factors such as if the parents aren't involved or if the parents use drugs, or if the parents aren't able to monitor the kid, whether it's purposeful or not. Um, and personal characteristics that puts adolescents at risk would be poor coping skills due to some negative emotional responses, depression, or maybe some strife they're having at home or their own insecurities. And sometimes they might want immediate gratification or to have some excitement. Also, when it comes to tobacco, um, risk factors would be peer pressure, and this could relate to their heart disease, nicotine, increased heart rates, increased blood pressure, lung cancer, lack of parental support, lack of attention, friends who smoke, and if they're not interested in education or school, or if they don't have other hobbies. Adolescence has life changes that other parts of development don't have, and some of those could be sexual development, sexuality, um, unplanned pregnancy, access to viewing sexual things, especially on TV and the media, teenage fatherhood, teenage motherhood, motivation for pregnancy, sex education, sexually transmitted infections, and contraception. There has been an increase in sexual activity as the years go on. Some of that could be attributed to the media. Some of that could be attributed to social media, mass media. And when it comes to unplanned pregnancies, the majority of the babies that are born are not put up for adoption. So usually the families will keep the babies. So there are some risks. There is the risk of prolonged labor, anemia, toxemia, hemorrhaging, miscarriage, and death. And then for the baby, there's the risk of being premature, weighing less than usual, living in poverty, and then the teenage mother not seeking out health care or prenatal care during that time. When it comes to the mothers, they're less likely to finish high school, be poor and dependent on social services, underemployed or not employed, lesser parenting skills, and it might interfere with their daily functioning in their life. Um, Depending on what the child has gone through due to the lack of resources, the baby might grow up and have some physical problems, emotional or intellectual problems. So social workers need to know the issues that teens could face when it comes to pregnancy and know how to counteract or prevent or protect the teen from these things, and having support and knowing options and helping them talk through decisions that they have when it comes to finances, employment, where they live, relationships, all of that is important. For teenage fathers, when it comes to unplanned pregnancies, there are some risk factors, which would be living in the inner city, living in poverty, not doing well in school, and then being involved in delinquent acts. Additionally, they might feel like they have to earn more money and then might feel incomplete if they're unable to support the household because they're still a kid or a teen themselves. They might feel overwhelmed. They might doubt their ability to be a good father or a provider. And they usually are the sons of absent fathers themselves, so they don't want to do the same thing to their children. So when it comes to teens getting pregnant, the textbook talks about them having unprotected intercourse, not using contraception, not knowing their choices when it comes to contraception, being embarrassed to talk about it, wanting to keep their activity hidden, lack of knowledge of what to do if they're involved in a situation. They might not believe they're old enough to conceive, or they might think it can't happen to them. There has been assessment of different types of sex education, and what has been found is that it seems to be important for them to learn about sexual activity in school, but not just how the body works, also of how to protect themselves from STIs, how to understand contraception, to give them the tools to talk about these things with their peers or with their parents. Just making sure that, yes, they can learn about abstinence, but also learn about what to do if for some reason they did not abstain. So that way they can protect themselves and protect their futures. So there are programs that will help children during these times if they're involved in any of these things. And of course, what to do if the child is assaulted in any kind of way. Identifying sexually transmitted infections. So the book on page 303 to 307 talks about different types of STIs and what the symptoms are. It goes over a lot of the common ones: chlamydia, gonorrhea, syphilis, pubic lice, scabies, genital herpes, human papillomavirus, human immunodeficiency virus, and ways of preventing STIs, which would be using dental dams, condoms, male condoms, female condoms. It also talks about prevention of pregnancy. This is a continuance of the list of highly transmittable diseases or infections. When it comes to contraception, the book talks about it from page 308 to page 316, 308 to 316. It goes into depth about all of these. It talks about the pill with estrogen and progesterone, and then IUDs, some that just have the progesterone in it. It talks about how it alters the uterus lining and basically makes the body feel like it's already pregnant. So that way it prevents ovulation. It talks about spermicides, female condom, diaphragm, sponges, cervical caps, the withdrawal method. It talks about various types of pills. And then the negatives of using contraception would be nausea, vomiting, bleeding between menstrual periods, and breast tenderness. And some medications already counteract these contraceptives, and that would be insulin, blood thinners, antibiotics, and tranquilizers. So a person might want to have extra backup when it comes to those situations. It also talks about some serious problems that doesn't usually happen, but they can happen. So heart attack, stroke, blood clots, basically cardiovascular problems, issues with legs, lungs, heart, and brain, dealing with the cardiovascular system and circulation, liver, gallstones, and jaundice. Also, those who are over 35, people who are overweight, those that smoke, or suffer from other health issues such as diabetes or other chronic conditions could have negative effects from birth control. And then it goes into more types. So there are Ortho-Evra, the pill that has estrogen and progesterone. There's a NuvaRing that can be inserted. And it tells you the pros and cons of each one. A lot of them overlap. There's the Depo-Provera injections, hormonal implants, so like the Nexplanon that's implanted in the arm right under the skin. It's long lasting. Some can last 12 years, some last 6 years. Emergency contraception, especially if someone has been assaulted. So there are a few different types of emergency contraceptions, and that can be given free in an ER, or it can be given, or someone could purchase it over the counter. There also talks about vaginal spermicides, basically that it will kill the sperm, so it won't be able to meet with an egg and cause a pregnancy. It talks about different types of condoms for men, but then it also adds in the female condom. There's a diaphragm and cervical cap, and those can be inserted inside the female. And a lot of those come with spermicide. And it's just important that people don't keep a lot of these in too long, because it could lead to toxic shock syndrome, and that could be a potentially fatal infection. Additionally, there is the birth control sponge that somebody can insert maybe 24 hours ahead of time. And then keep it in for 6 hours after intercourse. Talks about IUDs and how those can last from 12 or even 6 years. It talks about the different side effects, definitely when it comes to IUDs. A lot of it's like cramping, pain, but eventually the period should lighten. There's a withdrawal method. However, that doesn't always work. It talks about understanding fertility and knowing, using the calendar method and knowing when a woman is ovulating and not. And it also looks at the symptoms a woman might have around ovulation, so she knows when is a better time to have sex and also to abstain from sex. It talks about sterilization, so a tubal ligation or having a vasectomy, and explains how that's done. So, and then it also talks about some contraceptives for the future. So research is still looking into these. So the top ones were already mentioned on the last screen. And as far as future methods, it would be hormones, basically birth control for men. It's still being worked on because of the side effects of weight gain, acne, hormone changes, bloating. So those things they want to prevent men from experiencing when it comes to male birth control. And then it talks about one day having vaccines and having that be a contraceptive for males and for females. They also want to use chemicals to kill STIs. They are looking at spray-on contraception that could be put on the skin. Other methods of sterilizing that aren't as permanent, such as injecting maybe gel into the tube that carries sperm to the urethra. And so that way they could just dissolve it later. Also, they're looking at different types of new IUDs, so that way hopefully they can be smaller and less painful. They're looking at different vaginal rings, natural factors. They're looking at saliva and urine and see if that could let a woman know when she's ovulating. Sometimes people are using apps or computers, so a lot of that is being looked into for the future, hopefully to increase the awareness of contraception, and then also give people various choices so they can prevent unplanned pregnancies, especially for people that are not adults.